Thank you so much, as always, Amy, and thank you for sending the information out ahead of time for everybody to review, and thank you for making all the packets for everyone today. I really appreciate it. So we're going to call the meeting to order and begin with the roll call.
Dr. Jones.
Here.
David Thies.
Here.
Kathy Manuel. Dr. Goodley.
Here.
Dr. Reichstack. Dr. Peterson.
Here.
Dr. Sander.
Here.
Dr. Sermon.
Here.
Beth Benich, there not. Here.
Thank you, everyone. We'll begin with an approval of this evening's agenda. So I'll entertain a motion to approve the agenda. Thank you, moved by Beth. Do we have a second?
Second.
Moved and seconded. Any discussion on agenda changes? Hearing none, all those in favor of the agenda?
Aye.
Anyone opposed or any abstentions? Thank you. Our next item is in your packet, pages 1 through 3, approval of the minutes from June 10th. I would entertain a motion to approve the minutes.
So moved, and I have just one comment.
Second.
Moved and seconded. Discussion.
With respect to the reporting, the health status reporting, the language in the minutes doesn't quite reflect that there was a commitment to make an attempt to get those up to contemporary, in other words, monthly reports. And so what's in there now, when you look at it, is an asterisk that these are reported yearly. And I can wait till I get to that on the agenda, but that's what I meant when I made that addition in the minutes. So if the change could reflect that we were going to make an attempt to get it up to date.
Yeah, Mama D, do you remember what Rob and Candy said about the why those are no longer done monthly?
Yes, I have a note just to explaining that they have updated the data on our website. But to answer your question, I think there is a confidentiality issue because of STDs, cases that they collect in the clinic. So they collect HIV data and those data are kept confidential, and it's difficult
They're small numbers.
in terms of reporting to put those so that people can see the exact numbers of people who come and seek treatment in the clinic here. But he sent me an update about the first time you asked the questions on updating the data. So the CU-PHD communicable disease morbidity reporting table is currently up to date for non-STD disease as part of August 2025, with case count to be reconciled for Q3 at the end of September. The table has been revamped and updated to be in line with IDPH most recent reporting standard, with new subcategory for many arboviral and enteric disease. So arbovirals are Lyme disease and West Nile, for example. That would provide more complete information to the public. So STDs cases are currently up to date to December of 2024. But due to issue with the rollout of the new statewide reporting system, case for 2025 will be updated only at the end of the year.
So they're not going to change that.
No, and there is a reason for it. That's why I wanted to know if you remember what it was. That it's not really on our end necessarily. It's how. So what we're showing are only I mean, we only know who gets tested, you know, look right here, right? We need all the cases to come in or it's not even relevant. So it's the, I think it has to do with the states, the way the state is doing it now.
And then also, I think when they collect the data for this year, we won't be able to see it as of this year. So we'll only be able to see this year data in 2026. So that's why the data that's on our website is for 2024. And
Well, there is information on there on hepatitis C, which is a biggie. I don't recall looking at HIV. That would be blinded too?
Yeah, and I think it has to do with, because of small numbers, but
because any numbers, at least in any number in terms of making sure that most people confidentiality are kept. So any numbers that are below 11 are not reportable. So that's not our rule. So that the state's rule, just to keep confidentiality.
suffice to say, STDs are still out there and they're still running rampant.
Yeah, I mean, you're talking
they're
about
not-
hundreds.
Yeah.
Well,
So the data we're seeing as of today on our website are the data for 2024.
So how is it a confidentiality? I mean, this is a whole county, so if you just remove their name and any kind of identifying, just
well, that's
say,
how we used to do it, but I think we were mostly reporting our own numbers. We weren't like putting in,
Like they say,
Oh,
if the number's low enough, then you can identify who it is
Like-
somehow.
because we were reporting it by month, right?
Yeah.
So, I still don't know how you would figure out who somebody
Right.
was
Well, but
necessarily,
you're
but
looking
that-
at
it's their,
like-
it's their
You're
rule.
looking at a minimum of 30 a month on both of those.
Well, not HIV, certainly.
No, not HIV,
Thank
but
God.
Yeah.
chlamydia and gonorrhea.
Oh,
Well,
yeah.
chlamydia for sure.
Yeah, syphilis too is also.
But let's say Carl ER picks up a gonorrhea case.
Mhm.
They're required to report that to whom?
Well, they report it to us and they report it to the state, or unless that's changed. Remember, I did this a long time ago. Candy's
Yes,
not
right.
here, so
Yeah,
it used to be.
you were the chlamydia queen.
Right, so the stuff, indeed, and so, you know, the stuff would come in, and we did things a lot, you know, looser back then, if you will. I mean, we were probably just keeping track in a spreadsheet or something, but now it all has to go through, you know, the state system and all kinds of stuff, and it has to be reported in with all the demographic. Now, I can see if it's a small number, and it was like by zip code or whatever, you could probably, maybe somebody could figure it out, but I think that'd be stretching it. But
Yeah, so we have a
Yeah.
reporting system,
I mean-
but that reporting system is made available at the state level that we have access to. So any syphilis cases, for example, that you mentioned, are reported at the ED. So physicians are required to report that within 48 hours, and it will go through their system, and we will be able to see it. But in terms of like collecting all of those data and make it our own report, we won't be able to do that until next year. So
So your data's always on Google.
yeah, it's made our nice local data state
Yeah.
level annoying data, but some of the things we can still report. I don't think that's everything.
All right, I
All right.
will quit asking the question.
Well, I will.
That's a good question.
I mean, it is, and maybe Candy or Rob need to be here to explain that. So, I mean, because they can maybe there's something we're missing, but it's, I know that we talked to him right after the meeting, and they explained why it couldn't be done. And I knew his brain was more plastic than mine, so he would be able to remember that, and I don't remember it, but I know that we did talk about it, and there was it had to do with this, it had to do with IDPH, it didn't have to do with anything internally or anything.
But if there's a big epidemic or something
We-
like
we
that,
would know
then,
it.
We would know.
then
Oh, yeah.
we would switch
I think
over to
that-
it at
We-
that time.
we still react to things. I mean, we
Yeah.
still see them, and all the diseases that are reported have to be acted on within X amount of time. You know how that is. Each disease has its own little algorithm. I do know that our person Whitney, who does, not that Whitney, the other Whitney, who does the syphilis cases and stuff, she has come up with a new way to make sure that we're not missing, not us, but people who see the cases to begin with are not missing cases and ending up with congenital syphilis, which we have had. So,
Are there any other questions about anything in the minutes?
I think that was the question that I could remember.
Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions?
I'll
Thank you.
abstain.
Thank you. Public participation on our agenda items. Hearing, seeing no public. Julie, correspondence and communications?
no.
Nothing to do to report there? That takes us to discussion of a proposed County Board of Health budget. Travis was not able to be in attendance this evening since his regrets. I do have in front of all of you an update to the fund balance. If we would take a look at that, just to make sure we're kind of all on the same page with that. So on the updated fund balance, you can see we are currently projected to be at 30% of our fund balance if we stay with the current budget as proposed. This budget, from the proposals that we had before us in our discussion at the last meeting, this budget includes the $30,000 that was requested for sexual health education in the county. And it also includes the $50,000 that was requested for dental services for children and individuals in the county. It does not include the additional $25,000 that was requested to recruit additional dentists. And we had quite a lengthy discussion about that at the last meeting. There were a lot of concerns on how that money was being allocated. So based on that conversation and your guidance, I did not include it at that time. We can certainly revisit that. I will say that both individuals with proposals were asked to be at this meeting this evening to answer any questions that you might have. And I see Whitney is here from the team. Well, I guess it's not her team, is that what it's?
Wellness
I don't want to miss. I don't want to mistake.
Wellness and health promotion.
Wellness,
Oh,
yeah. Thank you. I didn't want to mistake. So she's here to answer any questions I might have, but I just want to start with that. So you do have the old information in pages 4 through 8, but again, that's been updated, hot off the presses as of today, so you know exactly where we stand in the current fund balance. And you also have the paragraph from 2022 where we had discussed and agreed to keep the fund balance at a 25 to 35% of expenditures. So as I said, right now we're right in the middle at 30%. So that's better than our discussion to last where we were going to be right around 23, 24%. And I think that was because the previous was predicated on those additional expenditures, which we don't have in there.
And if we included the 25,000, what would the percentage be?
That I don't think he's included in here, but
Do the math.
I'm guessing it'll be probably back to where we kind of, be. Oh, I don't think all the way down, but it'll be lower. Mandy, do you have any idea? If the additional 25 recruitment was included, how much more would that drop the fund balance? Do you have any idea?
It would just take 25,000 off each number.
What would be the percentage?
Since our goal is expressed 25 to 35%, where would we be?
Percentage-wise, I don't know what it would be, but
Fund balance is listed here in the budget is $582,000.
not on Travis's sheet. Travis said that current fund balance is projected to be 667,000.
I think the other thing to say too is we still haven't made the final Carl payment, is that correct? From what I understood from my last conversation with him, the final Carl payment was still outstanding.
I thought.
Is that being taken care of?
I
That was,
thought-
the last time I talked to him was early summer, so I didn't know if that had actually went through yet.
I think it's paid.
Has it been the last part, the
I
last
mean, that,
portion?
you know, between that and the presents and the,
Yeah, I just wanna make sure, cause then we'd have nothing else, I don't think that would be coming out. Just-
Yeah, I think the presents one is
Well, we have an advance payment in there too, that,
What, I'm so
we
sorry?
have an advance payment sitting in there that's gonna come out of that too.
Oh, okay,
Oh, we already have it earmarked, but it's not included in the.
so that's still gonna come out at 667 maybe,
Yes,
and do you know how much that'll be?
it was 100 and some thousand.
Okay, so if that comes out, then we're at 567. So that would drop it.
So this is, I'm trying to understand the 2026 budget fund balance number, 582,144.
no, you have to look on this. This is, he,
Oh, this is the one.
yeah, this is what, since Travis couldn't be here, this is what he put together, right? This is what Travis put together.
So that's a lot different than it was.
So
Yeah.
667.
Right.
I know, that's
With
the, we were like, okay.
With the additional 100 grand that Mandy's referring to, then that would go to
567.
567, yeah.
Okay, and so,
All right, so what I'm gonna do here is I'm gonna try to do some fourth grade math.
Like 3.7%, so it'd be,
I'm
Yeah.
sorry, Dr.
it would
Sean,
go
what did you
down
say?
about 3.7%.
It would go down about
If you do-
3.7%.
yeah, if you do like the 25 over the 667.
so now we would be within the 25 to 35, but low.
Given that we're like flying blind, it wouldn't hurt my feelings if you kept it in there, because we just have no
All right.
idea
So
what we might be coming up against.
What our budget is calculated to be, I had wanted those figures, but I got a hold of Mandy late this afternoon. $2,240,000 is what our budget is projected to be. If you use that if you take a 30% at 672 being a 30%. And this is where I warned Dr. Jones that I was going to talk about this. As you recall, last meeting, I said, wow, that seems high.
Uh-huh.
And, you know, I've been treasurer for a long time. So what I'd like you to take a look at is what came out with the column
That
graph
Mandy sent you?
here.
Yeah.
All right, there's no total on this, but if you take a look at the first column, it's property taxes. It's got us listed as getting $1.7 million in property taxes. Our whole budget is 1.2. So I called this afternoon and she explained to me that the county has a different way of accounting.
Yes, I was gonna say, that's why it's always such a nightmare with this budget, because remember Deb used to always be in here at
Yeah.
all the meetings because of just this, that they don't match up right. And we are always at the mercy of what they are, what numbers they are giving us.
Well, and so what Mandy thought was happening was that, well, the first thing she said is that Travis has no way of separating it out. Now, okay. So, it appears that CU PhD revenue is included in that property tax figure.
That's what I was going to
Yeah.
just say, that
All right.
it's probably because they have the whole county, because the taxes go to the county.
Yeah.
And then they pull out the Champaign-Urbana taxes, which is a different rate, and those go.
How much do you get?
Or no, we get the county, I don't know.
This year,
That's a Mandy question, because it's,
this year we're at 964,000.
Okay, 964,000 for you folks, and 766,000 to the county. We don't need a carryover for money that is passing through us in 5 minutes.
I don't think he's handling it any different though than what Deb and Tammy did, because otherwise we would have a lot smaller fund balance. So I think he's doing it the same.
Well, is it fair to say that our budget is 1.2 million and some change?
Yes.
Okay. 30% of that is a lot less money than we currently have in the fund balance.
But isn't part of the money that's in the fund balance being held kind of in escrow for the inevitable coming out of the present?
That 100K, I think she was just talking about, correct, is that right?
I didn't understand.
She was asking if the final payment to Presidents was included in that.
I think it has been, but I'm not positive.
Because, you know, we had to pay them for the district, but where does the money, we sent the money for this to the treasurer, correct? So,
It sits in the general fund balance, but
yeah,
it's
so it
earmarked,
goes,
so
it's like, it's county money, it goes over there for them to do it. So I don't know if that's reflected in there or not. I hate when we have a budget meeting and the person making the budget on that end isn't here. That's
Yeah,
always-
and we
it's always
don't
hard.
have answers.
Yeah.
Well, let's just see, let's say that our budget is 1.258 million. So 1.258 times 0.3 is 377,000.
But it's possible that that means that our goal of 25 to 35% really ought to be 55 to 65%. And why would that? Because we don't, when you think about what cash dollars might be needed if an epidemic hit tomorrow, it's not a percentage of anything, it's a dollar amount.
Right.
Which is so our number might be a good number, but our goal might be wrong.
We change, at the district, ours is now between 25 and 50, correct?
But
So we've got a range. You have a range
Our
too.
range is
Yeah,
25 to 30.
we got a range
Yeah,
too.
it's,
Yeah, and so we passed in 2022.
I mean, 50% would be 700,000.
This is, I guess, we can't answer the question here, but this is at a fund balance of 672, that's a lot more than 30% of our real budget.
How much cash do you need if we hit another epidemic tomorrow? How much cash do you need?
well, it's
A
hard
lot
to
more
say.
than
That,
600,000.
it's hard to
Well,
say.
that's-
That's because we
Julie,
never know what's coming
I
or
know,
what.
and you've already always made the point to me, that I recall, that we need more than the average unit of county government, because the kind of thing we might need immediately
Yeah.
is higher than,
Well, I mean, and with COVID, we eventually got that money back, but we immediately started staffing up and we bought the freezer, you know, that we knew the vaccine was gonna need before they were all gobbled up by other people. And so, I mean, it's hard to know what you're gonna, it's hard to
but,
know.
okay, but from a public health point of view, is 600,000 an appropriate number?
I mean, I always like more money in the bank than not. I just am more comfortable with it. I just am, but I can't say if that's, like, what is it, what do we have, what's the fund balance right now at,
for us,
yeah, like the amount,
the district,
yeah.
we have right at 8 million.
Not in the fund balance?
For the district?
Yeah, for the
Yeah.
district, okay.
So 8 million compared to our 600,000.
Yeah.
There's
Big difference in the kind of need.
Well, it's just, I remain confused with the county calculation versus the county calculation versus county board of health calculation.
Do we have extra funds, like maybe that accounts for it, like, is this 1 point, no.
This is it, so,
Chris,
yeah.
no.
Yeah, it's in a cave in a chest.
Yeah, no, that's it. That was part of why in 2022, we moved to make that
Arrange.
percent requirement within that to pass that, so that we, you know, would have dollars on hand for emergencies. But you have to understand, we also had a surplus of money coming in to deal with COVID from the CARES Act and various other
Yeah.
entities that we will not see,
Again.
probably not in the next several years anyway, should anything happen, you know, given, you know, the
Like bird
current
flu.
structure of government.
So is, well, my point is, I mean, we do anything with it we want to. Our budget is 1.2, and 1.250 million. And our fund balance is much higher than 30%.
Half that.
45.
Were you surprised by this fund balance when he gave it to you? No, okay. It seemed high to me, but that's not what we had been talking about earlier and all the different things, so I don't know.
Well, we give the district everything we got.
Right,
And
pretty much, I mean.
Yeah, pretty much. And so that's our budget.
Yeah.
And it isn't $1.7 million in property tax. It would really be nice for somebody from the county to come in and really explain this to us. I mean,
Yeah, and the issue, I mean, I'm sure we can get Travis in here. The issue right now is what's listed at the top is that it looks like there's only 2 people in the division. And
right.
I don't know if he means always or just like people are gone right now, but he's got to get the auditors did not get the 24 audit completed on time, and the fund balance and subsequently could in theory still change. So
Yeah.
that's kind of an important last line there.
Oh, so there could be revisions.
Yeah, his last line up here says, he said, keep in mind it's just an estimate since the auditor's office did not get the 24 audit completed on time, and the fund balance for 24, 25, and 26 could in theory still change. So,
You don't have to write numbers to me.
So
does
do we?
the auditor do their,
Seems angry.
do they not have their own auditor?
Well,
I guess
they-
it's also how
You
they
guys
do
have your-
accounting too.
You guys have
'cause
your
like-
own auditor, or? I mean, we
In
have
theory,
we have like an auditor company.
Yes, we have a third-party auditor that has basically taken over the audit because our auditor does not seem fit to do anything.
Is it?
There are different accounting rules, so whether you include pending transactions or not, you know, can make big differences in how numbers are presented.
If those pending transactions fall within the fiscal year that you're auditing, then you have to use that as.
But is that like based on receipt, or is it in promise of receiving? So GAAP rules or not, you know?
If there is actual documented, like this expenditure, you know, there's a contract signed, what have you, it's considered spent. It's not.
Oh, okay, so yeah,
Yeah.
so this is using that rule, so if
I know
anything,
there
this
are
would
certain contracts that are outstanding.
potentially overestimate how much we actually have, because like, people could not pay it.
That's correct, and then if this additional expenditure has to come out, understand that's gonna drop it pretty significantly. I mean, I think what we have to decide first and foremost are the 2 proposals that we have in front of us, or the 3, I should say. We have 2 from Promise Healthcare, and we have the one for the wellness prevention in schools. And we have to decide on each of those and what we will include in this budget. Like I said, right now, I have 2 out of 3 of those in the budget. We have consistently, for those who are newer, we've consistently funded Promise Healthcare and dental services to children in this, in the county for more than 15 years. You know, that's been an ongoing relationship that we have had with them. The recruitment is something that started new 4 years ago, and at the last meeting, I gave you the breakdown that they had provided to me of that, and you know, from that conversation, there were some concerns over how those monies were being spent from the way that they were intended. And that's why I didn't, based on that conversation, include it in this one. And I did again, they were asked to attend that last meeting, and I did again, you know, Amy invited them to be at this meeting. They're not here in this meeting to answer those questions. So I don't have any new information to provide in terms of that recruitment piece. We do get reports every month on the services that they're providing in the community, and those are included in here. So you do have those to, to review, as well as what the proposal was, and then their response to the question that I asked them at the last meeting, that we discussed at the last meeting. So that will be the information we have to make those decisions. We just need to make those and then go back to the budget if we have it in or if we have it out, and then look at the line items in the budget to see if there's any questions that anyone has on the budget. But those are the, I think we decide the proposals first, then go back to the budget, look at the budget, and then we'll need a motion for the overall budget with those proposals either changed or remaining as is. Unless there's any other questions or concerns about that process.
Now, the other thing in terms of the carryover, I guess, I'm just, I'll just step aside on that. We'll just carry over figure.
We can still ask, I was just talking to Dave about that, we can still ask Travis to come to the next meeting and provide additional clarity. We'll need the budget because of the Monday meeting with the county board. They have to have our budget now, so it is a time constraint issue. But we can still have him come and give further clarification on that.
And I'm not gonna bring this up at the county board because it's, who knows where that'll go.
So if we include the two that are already there and discuss the recruitment piece, and there's no additional information on that.
Yeah, I don't have any additional information. Amy, did they provide any to you in your email to them?
No, the thing with the recruitment that we pointed out was that they were apparently spending something like $6,000 a month for advertisers.
There's something like, is that even the relevant place?
Is that an effective way to do it? It seems like they certainly have a national association. It seems like that's where you would go.
Correct. Professional journals start there. There's so many other ways.
We also have really about recruiting for faculty in the med school. We go through the various channels of what relevant associations that we answer.
Right, exactly.
And those are not $6,000 a month that you have to pay out for
And
advertising.
the fact that they didn't show up, they didn't respond, I think that also speaks volumes about it. So,
I do know they are going through some administrative changes too. I want to be very clear about that.
They are. Well, in terms of Francis Nelson, I've been, I have been impressed with their progress. Right. I mean, it is a much more professional organization now.
Did we tell you that they're moving over into our East Wing? They're going to put a clinic in the basement of the East Wing that will be for moms and babies, and hooking up WIC and everything together, and our doulas, and so we're excited about that. September 3rd, I believe, is the start date for that, so we are excited about that.
So if we're looking here, we're kind of on item 3 at this point underneath G. So discussion and approval of proposed budget items. The budget request for funding for preventative services for adolescents in Champaign County schools in the amount of $30,000. That's items 10 through 16. So we'll just look at each of these proposals and see if we have some consensus on their inclusion in the budget.
Why don't you do it with the format of no objection and then we get it.
And let the record show Whitney is sitting behind you with puppy dog eyes.
Well, it would be a great program if we got rid of the director,
She does
right?
have. She is here if you have questions. I see.
Thank you.
Also, like any objection to the 30,000?
Thank you. Are there any objections? Thank you. Item B, budget request for general support for January 1st to December 31st, 2026, in the amount of $50,000. Again, this is direct service preventative care to children with dental caries and other issues that is ongoing in the county.
No objection.
Any objections to that inclusion in the budget?
It does just say general support on there, so you might want to specify,
I I think in the proposal they sent back, they gave some descriptions of, in that, response of things, but that's a good point, so I'll make sure.
Yeah, because it's for actual, like,
It's a as
fillings
per-
and,
As per their description.
The program that they described is about 37% county,
so, what?
37% county. The program they described, in terms of their reports, in terms of what they're doing. Which didn't bother me a lot because it's a general program, but unless I misread that, but what I,
Well, we are, right now, we're still on a waiting, we still have a waiting list, correct, Whitney?
Yeah.
So, then I have no problem with that. We're
I
all,
don't
we're all in the same boat. We're not,
Yeah.
it's not like we're going after, poaching clients from each other. It's just that until we have to get the dental hygienists in here, we're kind of stuck. They're hard to hire.
C, budget request for dental practitioner recruiting focus, from January 1st to December 31st, 2026, in the amount of $25,000. Are there objections?
Yes.
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 Oh, that was easy.
Oh,
yeah,
Dr. Goodwin?
Yeah, needs more care.
Okay, needs more time, so I'm saying this one, so one objection, two objection,
oh, yeah,
three,
same,
four,
same.
five, six objections. So 6 objections and 1 abstention to the $25,000 request for dental practitioner recruitment.
Now, if they came to us with a very good proposal, it then gets a little more difficult after the budget's been passed, right?
Correct,
Yes.
because the county will pass the preliminary next week, and then the final,
So it's a budget amendment, which has to go through county board.
correct.
And it has
at
to be
that
a
point.
I'd like to know why the best use of funds like that isn't to enhance salary packages for people coming. Which leads
It
to
would
the
be more of a
question,
bonus than a salary.
which leads to the question, why convince me that 6,000 a month is needed for recruitment? I don't understand how that's being done and why that's needed. So that's my question.
Also, like $7,000 for sign-on bonus for
Exactly.
this is out. I mean, I think for the police they're doing $10,000. Thought I saw that on the.
For ICE, it's 50,000.
Oh, I should join ICE.
That's,
Something
you really
like
want to read the fine print.
Yeah.
It is, you'll get 50,000, but you won't actually get it.
Oh.
You'll get 50,000 if you stick around for 6 years.
Oh.
So you guys have been saying something.
And then, please.
I missed the last discussion, but the $25,000, that's the total budget that's being requested to do the recruitment for the dental practitioners.
from us.
From us, it's our portion of their,
And what would be the total amount that's being requested? But, I mean, of course,
More than 60,000, 6 times 12 is, that's just the recruitment part of it.
that's just the advertising.
Advertising
Yeah.
part.
So that goes back into, I mean, from our part of it, I was thinking, but 25,000 in a budget of $1 million plus whatever, it seems like it's not that much. I mean, I'm saying, it's like we can, it's not that, overall, it's not that much of a question from us. But in terms of, so that's the one question, then what they're doing with it, that's a different question. So, in my management style, whoever is responsible for that reports to the boss. And the boss's job is to understand where and how they're spending money and improve that. All they're asking us is for 25,000 from this board to use towards that. We're getting, to me, it sounds like we're getting into the
micromanagement.
operational micromanaging of the issue because we've got some knowledge, a little bit about that portion of it. That's fine for a board to say to whoever, hey, you might want to look into how you're spending that because, we're okay with giving you 25,000 or 20,000 or whatever, but for us to then go over and sort of get into a different role where we're now in operations in terms of how you should spend this money, that would be, again, I mean, it's not in this part of the discussion, but
but I would caution the board not to be involved in the weeds in terms of trying to figure out, either it's, you're gonna approve the budget and give them access to do it, and who they need to report to ultimately to, Judy?
No, no,
No? To who they report to?
they're not part of us.
Okay.
They're separate, that's a separate contract. We don't monitor
They
it
should
or even
generally
even.
explain to us why they want the 25,000.
Yeah,
That's
exactly.
what hasn't been explained yet.
It's a-
Plus, and here's,
Yeah.
I realize it may be a drop in the bucket, but we do have other places we could put
$100% agree,
$25,000.
100% agree. I'm just saying, so either we're comfortable with giving them the money and they're gonna do what the heck want, but I'm not comfortable with saying you should do it, you're spending it, because I don't know the whole story. And how- Yeah, and I don't know if Indeed or whoever is the place to go, because I don't know what the return on investment, we put in $25,000 or whatever we have over the last couple of years, so what's our ROI? How do we know, I'm okay giving them 25K if over the last 4 years, that 25K has been, we've got 5 more dentists, we've got this or that, and we see it. And I don't know what the total thing, I don't know the weeds of it, I just know it's either been effective. So it was an experiment. We've been at 4 years. You should give us a report that says, hey, we've used this money. So I'm okay if you say you don't want to give it to them this year, don't give it to them this year. Let them come out with a proposal and say, and explain, here's what's happened with that money. And when we don't have it, here's the opposite thing we have.
I second that.
Yeah.
I think we agree.
So we're not gonna, let's do the budget without it.
That would come. Yeah, because it's such, this thing, it's
Let's
like.
do the budget as it's been.
And nothing prevents them from coming back this time,
Absolutely.
Yeah.
next year.
Next year they
and-
came
yeah.
in and they
Yeah,
discussed it and kind of justified, okay, this money that we've been receiving, this has been our outcomes, this is what we're trying to achieve. They give us a narrative, I mean, but they're not even showing up to the meeting.
And again, yeah, we don't want to I don't want to get into the weeds of it, because they got to figure out a strategy. At the end of the day, the strategy either works or doesn't. What we're trying to do is trying to recruit more dentists, practitioners. Is it working? Over 4 years, that's $100,000. Does it work? I mean, that's all you need. If it's worked, fine. If it ain't worked, we didn't come up with a different strategy, but this one is clearly not working, we're just spending money that we don't have.
Thank you, Ryan. So that moves us to approval of the proposed County Board of Health budget, so the overall budget. So if you would take that out, and I'll open it up for discussion of the budget itself for any additional questions on any of the revenues or expenditures that you see.
Yeah, I have just one here. I don't know what that $1,500 that's underneath the Smile Healthy 50. It says county ERP.
At their accounting system.
Oh, we're paying it for a piece of the
They
accounting
pay-
system
they
that
try
can't
to get
separate the district's taxes from ours. Okay. If we don't watch out, we're gonna get on a roll here.
We're good.
Other questions? You have our percentage of salaries on one sheet, and then you have the general categories of revenue and expenditure on the appendix B.
You usually have to give a summary, you want
Yeah,
to do
that would be great, please, thank you.
So, the taxes were budgeted for a 2.9% increase. We did a 4% wage increase, which is what our bargaining unit contract says we will do. The comprehensive local health protection grant decreased by $12,000. And the emergency preparedness grant decreased by $17,000.
Has there been any word, or have we heard anything about cuts to any grants or reductions or anything like that? Because I know university were pretty much watching the whirlwind.
Yeah, well, let me take that.
I didn't hear.
Okay. Oh, yeah, she can't hear you if you have a mask on.
Yeah,
So,
okay.
okay, but that's okay, I'll repeat it. She's just asking about our grants and what's coming in. So far, most everything's coming in. We've had 2 grants cut. We have made the commitment to staff to keep everybody on, barring some horrible catastrophe, until next year. We're trying to ride out as much as we can because it's super hard to have people leave because they're, scared, and then we have to start all over again. It's really hard, especially with some of these programs. So most of the grants are coming in, but what scares us is October 1st. That's what scares us, because just because we're getting things that were already allocated or things that were, that the state is acting as if things are going to continue. October 1st is what scares us, because that's the federal budget, so. And so we just don't know. I don't know how they've cut what they've cut at the federal level. I don't even know how, well, it isn't, things aren't working. So I don't know.
So some of this money is direct federal money and some of it is pass-through?
A lot of it goes to the state, yeah, a lot of the money goes to the state, and then the state sends it out to us. We don't have any direct federal grants, correct? It all goes through the state. I'm pretty sure right now, we've had some in the past, but I think everything goes through the state. But again, they're acting as if, like we are, that things will continue on, but come October 1st, we don't have any idea, and we are getting no indication. Always in the history of me doing this job, the federal people always talk to the state people, even if it's going to be bad. We're not getting that, so we don't know.
And there may be asymmetric state responses.
That's correct.
Are
That's
you
the other.
really
That's the other
asking?
thing.
Yeah.
That's the other thing. So we need to be ready for whatever.
We're gonna be punished.
Yeah. So, and right. I mean, the AIDS money, everything came in.
For the fiscal year or
Up until, yeah. So they've started the grants, but what happens is the state can start the grant, but then there's always that little clause in there that if the money is stopped at the state level, then they just stop them. I mean, it's just their contract's done, and you just come to a screeching halt, and hope to God you haven't overspent a lot of stuff, spent a lot that you won't get back.
When you're saying the state's acting like we can't.
They're in the same position as us. They don't have any idea because, in the past there's always been, there's different years and there's different kinds of political things going on, but they're still always talking.
Yeah.
And they're not. And they're not talking to the like ASHTO and NACHO and all the APHA and all the places. We're all just kind of hanging out, waiting to see what happens.
This goes
So
to
it could be very disruptive.
Yeah,
It could be very
it
disruptive.
probably will be.
Yeah.
It sounds like it will be.
It could be very disruptive.
We haven't seen what tariffs will do, and how that'll affect local economies and how that'll affect property values as well, like if we're seeing slowdown in the housing market. Some of that may be actually just the balancing of a mixture high.
Yeah, that'll take some time, but the cutting the federal grants off will not take any time at all.
No, if they do, they'll just say like they did with other places, no money, you're not getting that money. And then the states won't get contracts, so then we won't get contracts.
And the state can't make up all this.
Not all of it, no. They can patch little holes. In 2016 through 20, they were patching a lot of holes from weird things that, there were weird clauses put into grants that we just simply couldn't do our job if we did those weird things. We would not be doing it correctly. So the state said, we're not taking the grant, we're going to do it this way, and they cannot make up for all the funding.
And the state's in a deficit, right?
I don't know if they're in a deficit, but they're always,
Yeah.
they just don't usually have a ton of money. And if they do, it's always shuffling. It's always taking from something else. So, all the prices going up and stuff. That's so scary.
Vaccine availability.
Yeah, and
Vaccine
availability.
availability is, I ran and got my RSV today, so I can have a few weeks before, the COVID. I will tell you today, by the way, the old ACEP met, they're now called the Vaccine Integrity Project, and they did meet, and Illinois will be following that. We hope to God insurance will go along with that as well, but, if Vaccine Integrity Project, which is the old ASIP, if they and like the American Academy of Pediatrics and all these places came out and said, this is what we recommend, that's what we're doing. Because the group that's there now
Was the old group.
is not, the group that's at the CDC or the ASIP now is not qualified. And they're doing weird things.
He
that are-
ain't qualified.
They're what?
He ain't qualified.
No,
Yeah.
he could not get a job here as a case manager. No, I'm not kidding you, he couldn't. I mean, he literally is not qualified to have a job here as as probably anything. And it's just not his area. And he, oh my God, I don't even want to talk about it.
So
Right
from
now.
just from your department standpoint, I mean, there are some worst case scenarios when these budgets come up, you know, you guys done some sort of brainstorming on those sort of
Yep.
possibilities.
We've been doing it since election day.
And that may be something that
Yeah.
you can kind of get us up to speed on, kind of like,
Well, the thing with the staff, I mean, obviously, our
Right.
most important thing is our staff.
Correct.
Because you get rid of that knowledge
You got
and
no
then,
department.
and then if money does come back or we get a grant from somewhere else. So we're actively looking for other grants. Typically, when you have this kind of chaotic stuff, foundations start stepping up. IDPH has released some other grants. I think they're trying to scrape out every drop of money that they can that's might get yanked away. So we're doing that. We have committed to using part of our fund balance to keep staff on through July of next year, that budget. We'll know more in October. Again, barring something huge, like they just took all of our money or something. And we're moving staff around onto different grants, like the ones that, here's a good example. Whitney has a staff, and what they do is they help hook people up with Medicaid. They help them understand how to use it's like navigation, helping young people learn how to use the healthcare system. This is what these are the types of things you need, these are the types of things you need to look for, that type of stuff. So that's a program that is supposed to be getting, at some point, to be reimbursed by Medicaid. So we've had a social worker doing this now for how many years? 7? 7 years. We don't want to lose her, and then they decide, oh, you can start billing for Medicaid on this now, and then we've lost our person that's been doing it and set up the whole program. So we're moving people around, we're doing all kinds of things. We have a lot of contingency plans, we're looking at everything from early retirement to, everything, nothing's off the table. We look at everything every Thursday in our meetings. So, and we've paid off the building, we've got that, we've got the solar, we've got a lot of stuff going for us that's helpful, but you can't take a massive hit like that, if like what could come. I mean, we could, it would look different,
I mean,
so.
that's what this administration is sort of gearing up for. It's gonna take a lot of people dying before I think people really wake up. I mean, you're starting to see some minds switch over being like, oh wait, I can't get this access and stuff, but.
Well, of course, they put the Medicaid cuts past the midterm.
Yeah.
And I worked at a community access hospital for 5 years. Those are not gonna survive.
But
yeah.
not one of them will survive. But then they put the, 50 billion or whatever, or however much, into the thing to save the hospitals. It's all
No, to save the rural hospitals.
the rural hospitals. But again, do you think it's gonna be the rural hospitals in Illinois, California?
No.
So
2
that's,
hospitals closed in Chicago over the last week.
I know, that's just mind-boggling. And when people, when it will hit people is when they have a heart attack and they have to drive an hour to get any type of help, or 2 hours, or, they don't have an ambulance
We need to
service.
say that, like, telehealth services, like, I don't know, right now it's covered. I mean,
Well, they're not gonna be able to do CPR through a telehealth,
well, yeah, that,
I mean, or give you a little,
Intubate.
yeah. I mean, that's the thing, the telehealth is one thing, but,
We're also So one of my other roles is I'm chair of the nursing workforce center, so we're monitoring movement of nurses.
Yeah.
And, particularly in our rural counties, the southern seven downstate, people moving out of those areas, moving into, Chicago and Joliet and other areas for job placements. So it's not gonna,
And your
it's
health
not gonna be
and
Medicaid, but
administrator down
we're
there
looking
that
at,
died,
right,
probably from the stress.
staff losses, in those areas. And so if you can't staff these facilities in these local rural hospitals, because people they're worried, the movement's already occurring, people are concerned
And
that
then
they're not gonna have
And that's
jobs.
what we're
Get
trying to
travelers
hold on
is like
to
so
our
much
staff.
more money to pay for travelers than to employ somebody. I mean, that's the other.
Does it help? Canada's actually advertising, I don't know if you've seen it on Facebook, like scrolling through, but they're advertising for help when people come to Canada and telling them
Oh,
they
yeah.
get expedited citizenship.
Ireland,
Oh, wait,
4
really?
days. I was in
I-
Ireland in May, 4 days.
Just so you know, I had,
They
See?
get citizenship. If you're
They're
in
4
England,
days?
in 4 days, if you're a nurse, they will get you citizenship in
I
Ireland.
got contacted, and listen to this, and I said, no, wait a minute, I said, I know probably why you're contacting me, let me tell you, I have an MPH and I'm a social worker. Oh, okay, well, that's okay, you run a health department, that's okay. And I said, and I'm 60. And they're like, oh, well, you won't gain points for that. Right, so I'm not, I said, so I'm sure I showed up on some list, but I'm not really what you're looking for, but
It's
thanks.
got any calls,
Are they looking for like a top
They're,
Oh, sure
they're
they
looking
are.
for anybody with an MD.
They are, they are,
Oh, really?
Any
they are.
nurses, any,
It's not just
I
me,
don't know if
it's all
Cold,
countries.
global warming.
Yeah.
Be nice.
you better like snow, it hasn't hit yet.
Hey, after last week, I would take snow in a
Yeah.
heartbeat.
Yeah.
Hold on, they'll be doing the same thing in Hawaii.
Good conversations, everyone. It is. I mean, we're solving a lot of problems here, and I'm really happy about
Yeah,
it.
we've got them all.
Any other questions about the budget?
And Mama Do, you don't even think about it, mister.
Yeah.
Mama Do, you're on.
You know where we
The
could get
president is
budgets
being the-
is
the
if we could
president
come
is-
back
You've
from
joined the
last
Stamping
year.
down the enthusiasm here, okay. let's
We
get
should
to
love
work.
it.
The restaurant meeting, remember we were talking about the health inspection?
Yeah, we're gonna bring that up, Sarah's not here, but that's coming.
Good,
That's
good.
coming, we need to up those fees, absolutely. We've just
Unless there are any,
gone through
is there any other
Yeah.
discussion? I'm so sorry, I didn't mean to interrupt. Is there any other discussion?
Not that I move approval of the budget with, and make it clear that it does not include the recruitment fees.
Yeah. And is there a second?
I'll-
Moved and seconded by Dr. Turner. Any further discussion? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you, the budget is passed.
There you go.
Do we have any, are you, I think you're on the agenda still, Whitney, aren't you?
Yes,
Okay,
I don't really have enough date, but I will frame it better than that.
all right. Let me get there.
Okay.
We just, oh, this one's on me. I have to be out of town in November, and I wanted to see if we could move the meeting to November 11th. I have to be out of town at the current date. Oh, is that Veterans Day? I'm so sorry. Amy and I just
It
said,
is
I know it's
Veterans Day,
around.
yeah, that's Veterans Day.
okay, we can't do it on November 11th.
Is that our next meeting or is that
Yes, the next meeting is November
oh.
18th, and I have to, for work now, be out of town. And I wasn't looking at the last week, I was looking before, and you are correct, that's my apologies.
That is,
So we can't have it on Veterans Day. The alternative would be November 4th. The 4th I'm in DC, I'm so sorry.
what about the,
Yeah, the 11th will not be great.
APHA's in DC that day.
Sounds like
I'll
you're
be
home,
on-
sounds
I'm
like
on
you're
call,
home.
So it's usually a nightmare.
I'm so sorry.
I'm on call like on the 11th of November, so that's like, it'll be a nightmare.
Yes.
You said
And I
December.
would do it on a holiday.
I'm
missed
here
that.
the 18th, but the 4th through the 11th, I'm at
So
Cyprus.
the 18th was a problem for you?
Ooh, I would have joined
Cyprus.
you.
That's
cool.
I've always wanted to go to Greece.
Exactly.
The 18th is when
Dave, do
we
you
were
need help
scheduled.
with any of that?
Yeah.
Don't need any help.
Do you need Terry anything?
And you don't wanna do it, you don't wanna do it the 25th.
25th is, Amy, is there anything, and I probably should, because you wrote the bylaw, is there anything that prevents us from going into the first week of December?
think so, I think we did last year's in December.
We had to one year, I remember, because we had illnesses, we had a lot of COVID illnesses. One year, we had to go into December because of people were sick. But I'm just making sure there's not a bylaws issue that prevents that.
Not that I know.
Because I don't have it right in front of me, my apology. I could do December 2nd
I can't.
and not
I
do,
could do some.
does that interfere with anything for the county, Bethany?
They reorganize on that.
Oh, yeah, in terms of next year. Are we on this in December 2nd? The retired guy, he's probably gonna show me.
You know, yeah, it's just, I officiate
Oh, that's
still
right.
officiating basketball. Once we get into November, December, it's kind of cloudy for me.
Not a
The
basketball
issue
game.
is just that we're meeting at 5 o'clock. If we met earlier, it wouldn't be a problem, but once we get closer to 5, 6, he's gotta be there hour before.
Oh, I see. I think with our doc schedules, I could do earlier, but our doctors, I don't think are available any earlier.
Yeah, you gotta get through the day.
Brent's not here,
Yeah.
but I don't think Brent gets done until 4:30. Dr. Sharma went, or
Yeah,
Sandra,
that's, it's not, it's been a
I
battle
don't know,
trying to cover
university
this.
schedule. December 2nd, Bethany, is that work? Oh, that's okay. That way we avoid all holidays. Julie, your team available on December 2nd?
I mean,
It's after
knows?
October 1st.
who knows? It's after somebody will be here. Yeah.
We hope.
Well, you could say, oh, that's a staffing day. I don't know.
No, I mean, it's, yeah, there's no reason to think that we wouldn't be available.
So it's gonna be on the 2nd.
Yeah, as long as that works for the county board.
Do we have future dates
What do you want?
outlined for 2026 or no?
Very good.
Yes,
Oh, did we already do that?
Did we, I didn't know that's
we
good.
passed
I
that.
don't think we.
Yeah. We didn't pass
It's
that?
on the website.
It's usually the November meeting,
Oh, that we decide then.
it's when it's proposed and then.
Okay.
I mean, we won't meet again until February, March. Usually it's March.
March meeting.
Yeah. So December will decide March. Is that sort of?
That's fine. I just want to make sure I didn't miss something.
I know, our calendars get crazy. Yours already tied up, right? December 2nd, okay with everybody then?
No.
Making any assumptions? All right.
That should be fine, we don't have meetings or do the second floor of this.
Thank you, everyone. My sincere apologies that.
Krista, I did have something in correspondence.
Yes, please.
Krista just won a prestigious award that I don't remember the name of, but can you say what that is? Because I got the notification of it, and I had it printed out even to bring, and but I printed it out when I did it, so who knows where that might be.
Congratulations. We never-
Thank you. It's the Ruth B. Freeman Award for, it's given by the American Public Health Association for the National Nurse of the Year. So, thank you very much. That's very kind of you.
Sorry, I forgot.
Oh, no, that's very kind of you. Thank you
We do
very
have our
much.
biennial organizational meeting at 6 PM on December 2nd. So
Oh,
we
you
can get
do?
done in time.
Make it a quick meeting.
Do a quick meeting. Or I can leave early, as long as you have quorum, I guess.
Well, after October 1st, I guess.
Yeah.
Dr. Herman, when are you done? I mean, if we started at 4:45, is
I
that,
can do 4:45. I'll tell my schedules,
if we did 4:45, that'd be better for you and for Dr. Goodley? Maybe? So, for the one time, December 2nd, 4:45, 4:45?
45, I think.
Usually December isn't a really heavy meeting, but as I say that, we might have October budget
Yeah.
updates, and there might be more things to discuss, but usually, traditionally, it's been on the 1 hour.
It's been about an hour long usually.
Yeah, it's usually a quick one, because there's
Yeah.
not budget or other
There's gonna be
big
court
things.
challenges, you know?
But
That's what you imagine.
I don't know what'll happen in October, so
You
we
know,
might have
he's
lots
like
to
bought out
discuss.
all the judges too,
Yeah.
it's like, we live in a lawless country.
So, apropos of something, there are legislative budget hearings next week on the 26th, 27th, and 28th, if you want to come in and kind of corner Travis and hear the questions.
Oh, that's a great idea, thank
You
you.
might be able to do that.
I wonder if you'll be able to talk with him also on Monday, maybe.
I'll try to catch him, yeah.
I will ask him to come to
Where are
this-
we on the agenda for Monday? First or 10th or?
Did they tell us what?
Just for the budget.
Yes.
Yeah.
Did they give
It's
us a time?
6 o'clock when I start, that's all I said.
Okay.
They
Debbie's-
probably don't have it scheduled, so if you want to like call them and be like, hey, we have questions, and,
That's a good idea.
Yeah, I will do that this week.
Thank you, Dr.
Now, it's not at the old Brookins anymore, right?
Yep, it's nice new Bennett building downtown,
What floor?
flat, ground floor, you can walk in the door and it's right on the right.
It's right there, okay.
That's where like all the boards, I haven't been to that new place, but.
It's very nice.
Yeah, that's
It is very nice.
yeah.
I've been there. I'm disappointed I'm gonna miss it. So Dr. Peterson, just so everybody knows, is gonna represent us on Monday at the county board meeting. Unfortunately, I was already scheduled to be out for Peoria to interview librarians for the university, on a search committee that I'm on, and couldn't make it fit. So, and Kathy's out of town. So, Dr. Peterson, who has done it before with me in years past, has graciously agreed to do it with Julie this time. So thank you very much.
Are we anticipating, Beth, any
Surprise.
hostilities? I mean,
No, so we moved, board member comment to the very end of the meetings.
okay,
Oh.
So
wait.
we have public comment, but communications,
Does it get that contentious at these meetings? I need to go.
There's,
grab some popcorn and watch some close TV
Yeah.
on YouTube, and you will see.
there's a number of, basically Republican representatives that really would prefer that we didn't exist.
Oh, God.
So do we expect any of that? I know
Absolutely. I don't know.
we haven't in the past few years. It's been, we've just,
No, it's not that side. It's I don't know, but yeah, you'll be fine.
They
You're
have,
not,
they have security there.
It looks like
The
she
sheriff's
likes the
not there.
do you? Do you have security? Do you have security there?
Oh, not for the, I mean.
Oh, he
the
was
sheriff-
just kidding. I
Their
was like-
office is in the building.
Oh, I was
They're
like, what
upstairs.
the
All you gotta
heck?
do is call.
I was like, I'm not going.
I heard this year the National Guard was gonna be there to just make sure.
Yeah, all your, all,
We
all
should be freaking
all
out
of us
about
have
this
our
as a
papers.
nation, like, this is like such federal overreach, like, this
Yeah.
is like, this is, this is really bad, this is what happens in dictatorships.
You should be on our Facebook feeds.
Oh, yeah, see, I've been off the social media for years, I've been like, my mental health has been good
Yeah.
from that, it's been terrible in other ways, but.
Why harass my own mental health with my own page?
Yeah.
I'm posting everything.
I get lots of updates. Julie, I appreciate it. We are on H, Smile Healthy, monthly reports for May and June. Those are items 23 to 26 in your packets. I just need a motion to place those on file.
So moved.
Good. And do I have a second?
Second.
And is there any discussion about anything in the reports? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? Thank you. And then now we have two budgetary items, which are the invoices for the Child Dental Access Program for both May and June. I would entertain doing those together. Those are items 27 and 28 in the exact amount for both of $6,249.99.
So moved.
Second.
Moved and seconded. Any discussion about those invoices? Hearing none, all those in favor?
Aye.
Anyone opposed? Or any abstentions? Thank you. Now we're in the approval of CUPHD invoices for May and June for services rendered from the Champaign-Urbana Public Health District for county individuals. Those are items 29 and 30. So I can entertain doing both of those together too, if someone would like to move both of those, to place those. Lipton, do we have a second?
Second.
Moved and seconded by David. Any further discussion or questions about those invoices? Hearing none, all those in favor?
Aye.
Anyone opposed or any abstentions? The next is items 31 to 85. As we've discussed before, any contract that the district enters into that involves individuals in the county, we must also approve beyond just the district approving. So we have that contract available for review, a contract with the Champaign County Public Health Department and IDPH for the Comprehensive Health Protection Grant for fiscal year 2026 in the amount of $195,214.50 for the time period of June 25 to June 30th of 2026. So we would need to entertain a motion to approve entering into that contractual relationship.
I'll move.
Second.
Moved and seconded.
I
Any
have
discussion
some
about the
discussion.
contract? Yes, please.
And I'm learning how to read these things. And, actually, what I thought about was there's more boilerplate on that. If they'd used that on the Titanic, it might not have sunk.
Exactly.
There was a
And those, and every year it gets bigger and bigger. I don't know if you remember back in the old days, the HIV grants, they had like 2 pages on it. We were like, 2 pages of stuff the attorney has to read. Now it's like just page after page after page after page after
So I'm learning to just go to the appendix. And I see a couple of line items in it that are not funded, like prep.
Mhm.
What's that all about?
Prep, I assume that's regarding, there's 2 preps. There's the HIV prep, and then her program is called prep when it's done in the district.
Oh.
It can't be done in the city. I'm guessing that's what it is, so. It's not that prep. That prep is capital P, small r, capital E, capital P, and hers is capital P-R-E-A-P.
Personal responsibility education program.
Yeah, so that's what that is. So you don't get it funded, remember, you guys are funding the $30,000 to
Yeah.
do the program in the county because you're not eligible for the grant, because of demographics in the school.
Tanning beds is no longer funded?
No, I don't. Do we do that anymore? Like some of these we gave back to the state because it was just so ridiculous how.
Tanning then?
Wait, are you
I don't
serious?
remember
We used to
tanning.
actually do tanning?
No, we
still
didn't
do.
do tanning, obviously, look at me, but.
Yeah,
but
Public
we-
Health Department and tanning spa.
Yeah, cure that vitamin D deficiency.
No, we do, I don't know, I'll have to ask Sarah on that one, but we have done body art and then we gave it back to the state and then they changed it back, so then we took the grant back again. Tanning, maybe on the same thing. There are things we can do that we don't do because it's simply not worth it. You don't make enough money to even have a staff partially do it. That may be one of those things. The other one, swimming pools and hotels. State has to do that. Mobile home parks.
Mobile home
State
parks
does
don't
that.
do either.
State does that. So there are different things that may or may not be done.
So in some counties, those would be funded, but not in ours. Okay.
Yeah, because they may have like one staff that does all of those things, because some of the counties they're just different. I don't even know, do we have
I
tanning
mean,
bed
when I looked at it, I thought maybe it was a lack of
Maybe
federal
original.
funding.
Yeah, maybe there's not anything in the county, I don't know. That's a Sarah question. But the prep one, I definitely knew that one,
Okay.
so I get 1 point.
Any other questions about the contract? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? That now takes us to an update on the teen pregnancy prevention program.
Okay, I have one update. In June, I talked a little bit about how we've been trying to get into Thomasboro grade school for a while. And we were having trouble with the principal and the teacher, and we actually found out that our emergency preparedness coordinator, Lauren, who works here, her mother is the superintendent over there. So we were able to wiggle our way through her, and now we're starting a little bit later in August to do programming with our 8th graders. So that's exciting. Yes.
Sometimes you just need a way in to
You
get
need
to talk
a-
to somebody.
Yep. And that's exactly what happened. They had Lauren's cube is right next to our health educators' cubes, and she was like, well, I know somebody at Thomasboro. So we're not.
That's
That's
terrific. Congratulations.
But you know, it's good.
Yeah, exactly. Our next two items are placing reports on file, which we had an update on the reportable disease report from Mamadou earlier. So I'll just entertain a motion for the performance management reports and reportable disease reports to place those on file. And seconded. Any discussion?
Well, I don't have any real big thing about this, but I did even look at the performance management report. Okay.
You need to get cable TV.
Yeah. So, what is this, a rainbow coalition or something? I mean, it's all in the red or yellow.
Yeah. I can jump on this really fast. But we have goals and objectives for each department. And for example, for our planning and research, we track TB cases in our county, and those rainbow color is, green, red, and green, yellow, and red. So green means we are on target, and yellow means that we are trying to get on target, and all of those are depending on the cases that our disease investigators are working on. And then the red means that we are not on target, so we are not able to reach out to those people sometimes, or they'll just out or leave the county if we try to access them. So depending on the number of cases that we track over time and put on treatment, and also they follow up through those treatment, and infectious disease physician will call us and say that, all right, they're clear. So based on those numbers, we would be on the green or on the yellow, or on the red. So I think that's one example of how we track it. And those performance management trackers help us with our accreditation board, our FAB accreditation. FAB stands for Public Health Accreditation Board, and that's one of the components for quality improvement in each health department. So,
When he's talking about treating, I assume you're talking about the latent cases.
Yes.
Because we're really pushing hard to get latent cases of TB treated, so that it requires talking them into it, and it requires a lot of work. But the idea is if they get treated, then they're not going to end up, hopefully, in the hospital. They're not going to end up infectious. They're not going to end up spreading it, and they're not going to end up in isolation. So it's like selling it to them, because a lot of people, if you don't feel bad, and everybody
Well, how are these TB positives being picked up?
all over the place. They're being picked up at the TB cases, most of those come to us through the hospital. They get so bad they end up in the hospital. The latent ones are picked up through job screenings, different places, or from maybe immigration screenings, or from, just TB tests getting done. They may have been somebody who had a contact, so they get.
Is this directed therapy?
Oh yeah, we still do direct observed therapy with regular cases, but I'm talking about the latent ones. There are, I don't even know, there's a ton of latent cases. And it's a matter of getting a hold of them and selling them on taking the medication and getting the medication and keep following up with them. It takes a lot of work, but it's a lot less of a problem if you can get that done and they don't become infectious. Because, once they're infectious, then they have to go into isolation, and it's the problem. It's just a lot harder. Plus, a lot of times
Do you have some kind of protocol you've written for it?
oh yeah. Well, I haven't, but
Can you
yeah.
just send that out to us by email, so I can do it?
Yeah, you wanna see the TV stuff?
Yeah.
Okay,
Yeah,
yeah,
we'll
we
see.
got
Yeah, I'd like to see it.
How much do you want?
yes.
Well,
Because you may recall we had to put somebody in isolation before, and they wouldn't stay, and then they ended up in an ankle bracelet or
on latent
jail.
cases, you're not doing directed therapy though, right?
No, it's
No.
not, I don't know, they're not doing directly observed therapy on that. They're not going out there and watching them, but they are giving, get so many pills. Are they watching them on that? I don't think so,
No.
because there's no mandate for that. But like they'll get the drugs.
Well,
and
they
then
can be certainly non-adherent, shall we say. We're
Yeah.
not supposed to use non-compliant.
But they still
Oh, yeah.
have to be, yeah, but they're still being monitored a lot. It takes the disease investigators a lot of time. And then they're going back into wherever their health, Francis Nelson or wherever, and they have to get, testing because of the toxicity of the meds, so they have to get tested for various things, and they get tested to see where they're at, and they get the prescriptions from there, and then we
Yeah,
just
I'd like to
keep in
see-
contact with them the whole time, because it
Yeah.
requires a lot of,
Well, people who don't finish the therapy can generate even
Correct.
latent TB resistant
Yeah.
strains.
MDR2,
and that's why they need to be really convinced of it at the beginning, before we get going on it, 'cause I don't know if anybody's thought about it, but, we stopped all that AIDS money that went over to Africa. What do you think's gonna happen there, when all of a sudden everybody's yanked off those meds,
Yeah,
because they have them?
yeah.
Not only are people gonna die like wild, and they're gonna have the same problems that got them to get the money over there, but they're also going to start sprouting drug resistance, because I've heard something on NPR, and they're talking about how they're trying to, get drugs from all over the world that people can afford it, and so, you get it in fits and starts, and that's not good. Maybe we can spawn another thing.
Well, ask
that-
Kennedy
Yeah,
what he's
right,
gonna do about it,
Yeah.
yeah.
Super AIDS.
So just to clarify, you want,
Your protocol.
For the latent
For
TB, latent
TB,
TB,
yeah.
yeah, he knows the other, so latent.
Thank you. Are there any other questions on reportable disease or performance manager reports?
No, but would you also be interested in the stuff that was written up for the syphilis, congenital syphilis? Because that's pretty interesting.
How about prevention of tertiary syphilis?
There had been a national priority to do a better job on that one, as I recall, but maybe that's gone.
No, well, we were doing that before, because good Lord, if you get a congenital syphilis, that's just, my God, that shouldn't be happening in this country, and it shouldn't be happening anywhere. But
Should not.
Should not be happening in the developed world,
Well, we thought that syphilis was down to like a minimal number at one point.
It was.
Yeah, it was. It was.
What was the number?
I thought for sure that
Like-
I would not be dealing with TB and syphilis in my career. I assumed that would be done early on. in
Oh,
the
it's
first
like all the
8 years.
rage.
It is all the rage.
Oh.
It's quite popular. I
That's a
know.
lot, but I've been hearing.
Yeah, and monkeypox is still out there, FYI,
Oh, yeah.
Mpox. So.
Yeah.
We have some mumps cases. I'm just waiting for next week.
Yeah, mumps cases, that's another one.
There's a couple going on right now,
At the
and the students
university,
go
or
back
they-
next week, so.
All you need is one orchitis case, and that gets those vaccination rates right up.
So for
What if we start
measles,
seeing
we're
polio
as,
Oh,
for
God.
measles,
You
we're
could.
getting
Yeah.
really close, because
could in
measles
some
was
other countries
eradicated.
already.
Yeah,
Yeah.
Right
get
now,
over
we're-
2,000 cases, yeah.
We're getting really close to that 2,000 cases.
We're at like 400. Claiming it's dying down, but I think
You've
it's still,
regressed.
if you don't count it.
Put on your seatbelt.
First
There's so much
category.
progress going on, you've
Oh
gotta
my
be
God.
melted in.
It's just like such Orwellian doublespeak. Almost just
It
make
is.
America healthy. It's just like, no, I mean, maybe
We're
it's just
the
like
healthiest that we've ever been.
people just didn't read,
Anyway,
I'm eagerly awaiting my next colonoscopy, a tapeworm with a little camera on its head.
Oh, you swallow the camera? Yeah.
Oh, with like the pill.
They'll just stick the
Next
tapeworm in
item.
there.
Then you send it off to Cooler.
All those,
For long-term care bed update?
First of all those in favor?
Aye.
Anyone opposed? Any abstentions?
How'd we get on
Thank
this?
you.
Bring a
That's
camera.
my fault, isn't it?
Yeah.
Yes.
There is no additional updates on long-term care beds. Kathy isn't here, and I've heard nothing in addition to what I gave as a report at the last meeting, so no additional updates on that. Public participation on non-agenda
Yeah,
items.
please take a number first.
We need public. No public, but we must ask, it is a requirement. Our next meeting, as we have decided, will be December 2nd at 4:45. Well, that way, we can at least have a full hour, full hour, so you can travel safely to your next meeting. So with all of that, I would entertain a motion to adjourn. Moved, do I have a second? Moved and seconded, any discussion? Hearing none, all those in favor?
Aye.
Anyone opposed? Any abstentions? Thank you guys so much.
Thank you.
Thank you guys.
Happy Tuesday.
Happy